Yes. Okay, Mr. Bailiff, if you would please show the jury back in.
All right.
Very good. Be seated, please. Would the state please call its next witness?
Next, Your Honor, is going to be Dr. Aaron Ward.
All right, sir, if you'll remain standing, raise your right hand and let the clerk swear you in, please.
You solemnly swear and affirm that the testimony that you will give will be the truth and the whole truth, so help you God.
I do.
Have a seat there, and I'm going to ask you to sit up close to the microphone, adjust it so you can talk right into it. And then I'm going to ask you to tell us what your name is and then spell your name for the court report.
Okay. Aaron Ward, Aaronward.
Thank you, sir. Counsel?
May I proceed, Your Honor?
You may.
Mr. Ward, where do you currently work?
At Fraser Hospital.
And what is your job at Ed Fraser Hospital?
Currently, I'm the hospitalist at the hospital. I take care of people who are admitted to the hospital.
Dr. Ward, how long have you been at Ed Fraser?
I believe I started there in September of 2017.
And what are your current duties and responsibilities?
Well, currently, I take care of people who are admitted to the hospital side. I don't work in the emergency room anymore. But when I started at Fraser, I was primary and emergency room doctor, functioning in that capacity up until, I think, about mid-January of this year.
Before you went to Ed Fraser, where did you work before that, Doctor?
I was in Georgia. I was working at Wayne County Memorial Hospital in Jessup and then Liberty Regional Hospital in Hinesville.
And what were your duties and responsibilities when you were there?
I was functioning as an emergency room doctor.
And can you tell the jury your educational experience?
Sure. I went to or attended Windsor University School of Medicine. I started that program in 2008, graduated in 2012. And then I went to Tallahassee Memorial Hospital, where I attended the family medicine residency program, and I graduated that program in 2017.
Roughly, Doctor, since you've been at Ed Fraser, and it's been a number of years, you've treated a lot of patients.
Yes.
Approximately how many different patients would you say you've treated?
How many patients?
Yeah, thousands?
Lord, I don't know. I would think so, because I primarily work a full-time job at one hospital, then I'd work another full-time job at another hospital. So for several years there, I would work probably 26 29 shifts a month.
Okay. As a doctor treating all these different patients, have you treated a lot of children,
Sure. Yes.
infants?
Yes.
What type of injuries have you treated with involving infants?
Injuries? Anything from taking a splinter out of a toe to head injuries, children, involved in falls, farming accidents, burns, broken arms, broken bones, things like that. Something, stuck in the nose, stuck in the ear, things like that.
And have you been involved in cases involving infants where unfortunately they passed away?
Yes.
Deceased? How many of those would you approximate?
I don't know, probably a dozen or more. If you go back into the residency program too, probably about 24-ish.
Have you ever been involved in a case, not talking about this case, involving an infant who passed away or a child who passed away due to heat stroke?
No.
Okay. So let me take you to July 19th of 2023. Where were you working at that time?
I was working in the emergency room at Frazier Hospital.
On that date of July 19th of 2023, doctor, did you have an occasion to treat or to see a patient by the name of Araya Page?
Yes.
Okay. Can you tell the jury, did you determine the approximate age of Araya Page when she was put into the hospital?
Well, she was an infant. I didn't know exactly how old she was whenever she first came into the hospital, but obviously an infant.
Can you describe to the jury when you first saw the patient, Araya Page, how did she appear to you?
She appeared to me obviously deceased. Her skin just didn't have any perfusion. She was in rigor mortis.
When an individual, an infant, is brought into the hospital like that, are you normally briefed on what's going on?
We're briefed to the extent of the knowledge of the people who are briefing us. So sometimes we may not, if the paramedics or the firefighters or the law enforcement folks or family are bringing the patient in, they may not know everything that's going on, but we're briefed to the extent of the people's knowledge who are bringing the patient to us.
Is it important to be briefed in order to maybe do some sort of treatment on that patient?
Yes.
Were you briefed on the situation involving Araya Page?
We got a report over the radio that we knew that the EMS and the fire department and law enforcement had gone out to a child in a hot car. And we were waiting we have a radio in the ER at the nurse's station, and we can hear some of the traffic, not all, but some. And we were waiting to see if they were going to transport to Wolfson's, call a helicopter to the scene, transport to us, or pronounce the patient there, the baby there. Everybody had a lot of anxiety whenever, they were bringing the patient. We heard on the radio report that they were bringing the patient to us, CPR in progress. And it appeared, it's July in Florida, it's hot. We started prepping the resuscitation room, and when EMS came in, there's not that much really briefing on, on the radio. There's a baby in a hot car, CPR in progress. EMS gave us more information, but there was me, there were some nurses, there were respiratory people in the room. I think there were deputies around. And there was a lot of chatter, which would be the brief,
Yes.
But whenever I saw Araya, none of that really mattered because she had obviously died.
So that was evident to you immediately.
Yes.
Can you explain to the jury what is rigor mortis?
Well, it's when the muscles, the extremities, the body is, in layman's terms, stiff after death. The joints are rigid. It depends on a lot of things beyond my expertise, but depending on temperature and such as that, there's different phases of rigor mortis, where it begins, where it's at its peak, and then when it starts to relax. But it's an obvious sign of death. It's an indication to not perform CPR. If you're in tune to that whenever you see the patient, sometimes with children, sometimes things that you learn in training goes out the window, and you treat the patient anyway, and you take them somewhere else where they can get better help. And I think that's probably what was in the mindset of the rescuers that day.
Doctor, do you remember when you saw Araya, what she felt like, meaning her skin?
Hot,
Hot.
very hot.
What does it mean that Araya was fixed or dilated? And dilated. What does that mean?
That's her pupils. That's another, it's one of those things that you put in context with the other clinical findings on your physical exam. Someone who's deceased, their pupils will dilate and get larger, and they don't respond to light. So if we shine a bright light in their eyes, they don't constrict, and they should. And hers did not.
Would it be fair to say that she was deceased on arrival?
Yes.
Was an EKG performed?
I don't remember an EKG being performed. One would not be indicated if there's rigor mortis.
Okay. Do you remember what the differential diagnosis was?
I guess you could use a general. No, sir, I don't remember. I think that it was pretty obvious based on just a brief report that we got. There's a child in a hot car in Florida in July, and she comes to the hospital with no signs of life, no pulse, rigor mortis, lividity, fixed and dilated. The differential diagnoses are very, very limited. You know, it's a heat stroke.
And if I were to show you the medical records from Ed Frazier, would it refresh your memory as to what was put down as to differential diagnosis or the clinical impression?
Sure, it might. I'll take a look at it.
Yes. Your Honor, may I approach?
You may.
May I approach, Judge? Thank you. Doctor, just look it over a little bit, and then I'll ask you a couple questions. Thank you.
Okay.
All right. Can you tell the jury what is the clinical impression and diagnosis?
Clinical impression is death secondary to heat stroke. And diagnosis, the differential diagnosis I'll list here, dead, heat stroke. Yes.
Thank you, Doctor. After you determined the diagnosis for Araya Page, did you then inform the family that the child was deceased?
I informed the mother and her mother-in-law. They were the ones who were there at that time. To my knowledge, they were the only ones who were there at that time.
Doctor, when all this was done, were there several nurses that were present?
Yes, sir.
was one of the nurses a nurse Charles Smith?
Yes, sir.
And do you recall which nurse took the temperature of the child?
I do not recall which nurse took the temperature.
Okay, but was the temperature taken of the child?
It was.
Okay, was that something that was requested?
Not by me. I think that was something that was requested by the medical examiner whenever the nurses called to let them know that there was a death in at the hospital.
Is that customary to request the temperature after a death has occurred?
I don't know. I think that would be a question for the medical examiner. I don't have any training in forensics, and maybe that was something that he was, some information that he was needing. I don't know what.
But your understanding it was requested by the medical examiner's office?
That's my understanding.
Doctor, thank you. I think
Yes, sir.
I tender the witness, Your Honor.
Cross-examination?
Judge, I have no question, Dr. Ward.
Okay.
I have no question.
Okay. Can we excuse Dr. Ward?
Yes, you can be.
You are excused. Thank you, sir.
Thank you.
Thank you, Doctor.
Would the state call its next witness?
Charles Smith.